It is the afternoon here at Dentistry Show London, but we're not flagging at all. In fact, everything is just still continuing to buzz here so far, and I'm very, very pleased to be joined by Lisa Bainham. Lisa is the chair of ADAM, the Association of Dental Administrators and Managers.
Wow, well done.
I got it right. There we are, that's good. Lisa, your talk today was titled Pulp Friction.
Yes.
Why is it that you feel that conflict and drama are so prevalent maybe in the field of dentistry?
After visiting hundreds of practices, believe me, there's no practice that gets away with drama-free days. There's so much. I think it's the mix of skills and people and ages, and it's all kind of in a boiling pot of stress quite often. So yeah, it's very, very easy, when we've got owners and managers that are sometimes not seeing what's happening. Dentists that are managing the practices are doing dentistry. They don't know what's happening outside of their room quite often. So yeah, it's a bit of a boiling pot.
So what do you reckon are your top tips for trying to resolve that conflict?
See, believe it or not, I'm a bit of a direct person. So I'm one for outing conflict or outing, not, oh my gosh, is that person, what's going on? Are you all right? And actually just having open, honest, non-confrontational conversations and dealing with the issues. Not many people, I would hope, that get up in the morning and go, do you know what, I'm just going to go fall out with people today, or make up gossip and all of these things. So it's about having a really nice culture. So, and also knowing that instead of, behind closed doors and letting problems like fester, we actually go, right, what's going on here then? Oh, right. Because quite often it's not people that are having the problem. Well, it is, but at the root of that, there's something wrong with a system or a workflow, or the way that we're leading our teams that's causing that problem. So looking at the root cause, it might be the organisation chart, it might be that some people are treated a little bit differently, and are they? Is it fair? All of these things, we have to look at our management systems.
So with all this in mind, how does dentistry need to change in the future if it's going to address some of these issues? Is it around training and development? Is it around some of the softer skills maybe? Well, what is it?
For me, it's about getting people doing the job that are right for the job, not just inheriting a position, which can sometimes happen. It's not to say that somebody that's, hasn't got the qualifications isn't going to be able to do a good job, because for me, the soft skills, having the right people as leaders and managers is so, so important. With my clients, so often, it's, this has just happened, how do I manage this? And it's more, quite often, life skills and communication skills that get you out of these situations, just by being, a really good leader, because it's actually a privilege to manage people, not a position to, use that to make things difficult for people and ignore conflicts that are happening that can actually really affect people. When they go home at night, it's no job's worth that.
I think dentistry overall is a stressful profession. Do you think anything else needs to happen, whether that at a governmental level or whether that is in other organisations, that can help make dentistry maybe a better profession from that, more family friendly even potentially as well? Yeah,
it's difficult. I mean, one of my main training sessions is complaint handling, and apart from HR, complaint handling is one of the most stressful things that can happen. And I think over the last few years, 10, 15 years, there's been quite an influx of patients. They've lost the respect for the profession a little bit, and it's so wrong. I've seen patients come in and speak to people in ways that you just would never, ever have had, 10, 15 years ago. So I think it's, trying to improve the positivity. Dentists are getting a hard press at the minute, and it's so unfair. So I think as a nation we need to try and address that, and look at how we provide dentistry and keep everybody happy. So it's a bit impossible really, I'm sure, but I think if we can be aware of what people want, and I think the government needs to really step up and make sure people are being looked after.
It sounds like we're taking some steps in the right direction overall. Thank you very much, Lisa. We'll be back very shortly with more people to speak to. Thank you. Thank you very much.